Okay, I guess we're ready to begin here. And all of you, I'm sure know Bjorn already, Bjorn Christ. But I just thought I'd officially introduce him as the host of the Adult Ed Committee. And not all of you, including me, have been at first service, but if you were at first service and you heard the text, it's the raising of the son of the widow. The son who's died and been carried in a coffin, and Jesus raises him.
No, that's not.
And so when we were talking about this in committee, thinking, what can you do? What can you do? We got that defibrillator out there. Anybody know how to use it? We started talking about emergency times and what might happen at church or somewhere else in your home. And then Pastor Peter said, well, Bjorn is now a trained emergency tech, and he could come and talk to us. And I said, great, so welcome, Bjorn.
So yeah, I'm Bjorn. For those of you that don't know, I got my undergrad from Luther College in health sciences, and then last spring I completed my EMT certification. It means emergency medical technician. It is one of the kind of lower levels of training in terms of emergency service, going all the way up to paramedic. I'm not there, maybe we'll get there, we'll see. But so all of this stuff that I will kind of tell you about today, I have been trained in. I am also by no means certified to train you. So this is not kind of any official training or anything. This is just sharing some knowledge so that hopefully if something does go wrong, or you do experience an emergency here during service, or on community dinner night, something like that, you have a little bit better sense of what you can do to be helpful in a room full of people that all want to help. So yes, no official thing, but just hopefully this information is helpful to you, gives you some peace of mind to kind of move about your life here at Prince of Peace. So today I'm just going to kind of go over common medical emergencies that we might see here. It's not going to be an extensive list. It's just kind of the ones that you're most frequent to see and kind of the easiest for you guys to be of assistance. And I'll talk about how to help a person experience a specific type of an emergency, and then also when to make the decision to call 911. That's usually the biggest question if someone's not doing well. It's, do we need to call 911? Don't we? And then I'll give you a kind of overview of our AED and just a brief refresher of CPR. I'm sure plenty of you have had CPR courses in the past. It does update every now and then, and so there's some more recent changes that might be helpful for you. And then just a quick demo of the Narcan. We do have Narcan here now, and so just kind of how and when to use that, that might be helpful. So today I'm going to go over strokes, allergic reactions, injuries of many kinds, and then switching to kind of more unconscious emergencies of fainting, seizures, and heart attacks. So strokes caused by some disruption of blood flow to the brain. I'm sure plenty of you know people who've had strokes. You've seen that kind of facial droop on that picture there. That's kind of the classic telltale sign.
Bjorn, could you be a little closer to the mic?
Oh yeah, sorry, I'm on this guy here.
Or turn it up.
It's a problem for Chris, not me. Check. No, check.
No, you're not on, I don't think.
That's an issue. Oh, there's something. There we go. Now you can hear me.
Thank you.
Yes, so strokes. I'm sure plenty of you know people that have had strokes. You've seen that little facial droop. Maybe they're still dealing with some kind of one-sided weakness. Strokes are, of emergencies, one of the easier to identify. It's pretty rare that they don't present with some strong physical symptoms. And so with strokes, it's important to act fast. And so you're looking at their face, their arms, their speech, and then thinking about calling 911. For face, you're looking for one-sided droop. It can be either on the left or the right. Easiest way, if you think someone is a little droopy, is just ask them to smile. One side of their mouth will smile normally, the other kind of just gets stuck, and it doesn't move too much. Another telltale sign is they'll miss kind of those forehead wrinkles when they smile, smile lines around the eyes, and then the cheek will kind of feel a little low. It won't be kind of upset in that cheekbone. And then if you do see someone facial droop, you can ask them to close their eyes and hold out their arms. And if one of their arms kind of starts to drift either slowly or pretty quickly, that's another really telltale sign that they're having stroke. Their speech will usually be slurred. A lot of times it's because of the loss of muscle tone in their face. So that one's probably the first sign that most people will notice is someone's not speaking as clearly as they normally do. And so if you notice someone slurring their speech, you can ask them to smile. Ask them to hold out their arms just to kind of rule that out. That can be, when you're having coffee, talking around, talking with your neighbor, or if you're sharing the peace, or if you're just sitting in church and the person next to you looks a little droopy. It's a great thing to just ask, just to make sure that they're doing okay and that they don't need any further help. If they do show these signs, that's an immediate call to 911. There's nothing that you guys can do. There's nothing that I can do even as an EMT that would help a stroke. The only thing that's going to help that person is getting them to a hospital as quick as possible. So if specifically the facial droop and the arms drift, that's a quick call then, and that's pretty cut and dry. Allergic reactions, they come in all shapes and sizes. I'm sure plenty of you have allergies and dealt with your fair share. In case of serious allergies, most people that have anaphylactic reactions know that they have anaphylactic reactions and are prepared to avoid that kind of thing. But that being said, cross-contamination with food still happens, bee stings still happens. And so it's important to kind of know what to look for. Specifically with anaphylaxis, a person is going to have kind of redness around the throat and chest. Sometimes it'll be bumpy, it kind of looks like a rash. And then it's just going to be really hard for them to breathe. Ideally, they'll notice before they actually can't breathe, and you will notice before they actually can't breathe. But if you ask them, hey, open your mouth, the inside of their mouth is going to be swollen, the tongue's going to be swollen. That's just kind of what happens with anaphylaxis, is the throat and mouth just swells up to the point where air can't get through anymore. The only way to really help this is an EpiPen. I don't believe we have one here at the church. Chances are if someone is allergic with an anaphylaxis reaction, they will have their own. But if they're unable to administer it for themselves, it's important that you guys can kind of help. Luckily, it's one of the easiest things to do. So an EpiPen usually looks like this. Sometimes they look a little different. Sometimes they come in little square canisters that are actually have voice instructions out of it. But if you forget this, it's always on the side of the EpiPen of how to use it. You grab it around the center. You don't want to put your thumb over the top just in case that's the side with the needle. You take off the blue cap. Blue to the sky is what I was always taught. And then you aim for their outer thigh. So you're not going right on top of their thigh, but kind of right to the outside. And that one says hold it down for 3 seconds. I like to hold it down for 10, just in case there's a little bit extra. Because with EpiPens, it's a standard dose. It's all across EpiPens, and you want to make sure you get all of it into that person. So you hold it for about 10 seconds. And then I was always told once you remove it to kind of rub the skin pretty firmly, just to make sure it gets into that bloodstream pretty quick. And then after you use an EpiPen, you always want to call 911. There's a chance that one dose might not be enough. And so it's important to get them to see medical professionals just in case something else were to happen. Yeah.
Do we need a prescription? How can we get one for church if we don't have one?
That's a great question. I don't think you need a prescription. I think you can just buy them. I'm not sure where you would get them from. The issue with EpiPens is they do expire and they're pretty expensive. So certainly a question for someone else on a different committee, but certainly a good thing to look into. Just having one just in case, but usually people that have anaphylactic reactions are aware of it and have one. Yeah.
The expiration date, we did check with an MD and he had said typically you can go a year beyond.
Absolutely, yeah. Yeah, I mean, I worked at Christicon in Montana this last summer. We had some EpiPens that were 2 or 3 years old, and those were the ones that we kept just in case. But they will still work, just not quite to the desired effect. And so, but yeah, certainly a good thing to maybe look forward to in the future.
Can you just briefly at each of your slides, it's always ending in call 911.
Oh, yes,
People are always hesitant to call 911
Absolutely, yeah.
because it seems like a big deal
Mhm.
and it's probably gonna cost money.
Mhm.
But I've heard from multiple EMTs that there's no cost unless you're transported.
correct.
Can you just clarify that?
Yes, so if you call 911 and medical professionals come to assess you, you have the opportunity to refuse transportation to the hospital. If they recommend it, I also recommend that you go to the hospital. If they think you need to go to a hospital, you probably need to go to a hospital. But if they come and check you out and you're fine, that is no cost associated to you. You know, that is just, that's a good thing. That's why they're there, is to make sure that the people that do need to go to the hospital, go to the hospital. The people that don't have to. So if you call 911, they come check you out, you're fine. You don't have to pay anything, nothing's fine. You know, everything's fine. Everything. Did that? Perfect. And yeah, so after someone has a stroke, someone has anaphylactic reaction, and you use an EpiPen, that's a good call to 911. If you're having a severe reaction to an allergy that you're not used to, but you're still able to breathe, you can drive yourself to the hospital, that's just fine. If at any point on the way you're not able to breathe, that's a pullover. Call the paramedics, make them come to you first.
If you call 911, is it an EMT who will come?
Most likely in the metro, it's a paramedic. So right now I'm working for Alina EMS. I mostly do discharges and interfacility transfers, so I'm not on a 911 call. And I think Alina only has one rig that is staffed with EMTs that do 911 response. Just because of the variety of 911 calls, the training level of a paramedic is usually preferred. They're able to do more, they're able to help you a little bit more. And so chances are it'll be a paramedic that's coming, yeah.
Yeah, so I would just advise everybody to know the exact address of this church.
Absolutely.
Because about a year or two ago, I needed to call 911 and they said, where are you? I said, Prince of Peace Lutheran, Victoria, and County Road C. And she said, no, I need the exact address. I mean, I didn't know the number. And she looked it up. But you know, I felt like, oh gosh, are we losing time here? And I don't think we were, because I think she was already putting things into motion, but you know, it's a little panicky when she says, no, I need the exact number.
Absolutely, yeah. And I know that dispatchers like to have the exact address. If you really don't know it, they'll figure it out. You say I'm on the corner of County C and Victoria, that's what they'll tell their paramedics. They'll go there, they'll see, oh yeah, there's a church right there. That's where this is happening. And that goes for anyone in the world, you know, if you know a general location, it's better than not knowing where you are. But yeah, pretty standard stuff. All right. Injuries, they come in all shapes and sizes. Probably the most typical we will see here is burns if you're doing something in the kitchen, or falls. For burns, it's pretty much just use your best judgment. We do have, there's this handy dandy burn kit. Lives under the sink, the small sink over there. There's some burn gel, a couple pads, burn cream. It's there if you need it. You know, it's cold water, nice. Anything to really make you feel better. If it's severe and blistering, you probably want to go get that checked out by the doctor. But that's maybe a trip to urgent care. You might not have to go to the emergency room for that. And that one just kind of, sure, we've all had our fair share of burns, and you know, touch the stove when it's still too hot. Just kind of use your best judgment for that. Falls, especially now that it's really snowy, really pretty easy to slip and fall outside. That's something that we might see quite a bit. Again, with falls, it's mostly just use your best judgment. If a person falls and they're still conscious, they'll be able to tell you what hurts, where it hurts, how you can help them. That one's pretty easy. They get a bump on the head, maybe just keep an extra eye on them, on how they're behaving. You know, are they acting a little confused or more so than normal? Typically with falls, if someone's really, really hurt, you don't want to move them unless it poses further danger to them. So if you're outside and it's -5 and somebody falls and they don't want to get up, that's one where you might want to consider slowly and carefully bringing them inside. Just because if they stay out there much longer, there's going to be some more problems because it's really, really cold. But if someone trips on the carpet and falls and, you know, nothing's going to fall onto them, That one's one where you don't really have to move them. You wanna make sure that they're okay before you get up. And a person that's fallen will most likely be able to tell you, oh no, my back really hurts. Oh no, my neck really hurts. Oh, I just hit my knee, that's fine. Specifically with back, neck, and head injuries, you just wanna be a little more careful. It's not an immediate call to 911, but if you like are in real pain and cannot move your neck, cannot move your back, that's an instance where something might be broken, and that's a good call to 911. And again, if they come and they check you out and they determine you're fine, nothing needs to happen. But also with those types of injuries, it's a little harder to tell from the EMS standpoint. That's one where you probably need to go get an X-ray, you probably need to go get an MRI. So it's a little tougher to figure that out.
I noticed people tend to have like a reaction against someone being on the ground. And try to encourage them, to get up instead of just, letting them be and taking it as it feels right for them.
Yeah, absolutely. Yes and no. I mean, I think being on the ground is not necessarily a bad thing, but also it's not going to be very comfortable for very long. If someone falls and they're hurt, it's okay to give them 2, 3, 4, 5 minutes to just stay still. That's usually when kind of initial pains of falls will subside, and any lasting pain is likely due to a break or a tear or something like that. And so it's okay to give them some time as long as you're not sitting outside on the pavement. If someone falls inside, it's okay to just be with them, give them some space, make sure they're okay, and then only really try to get up if the person that fell wants to. But you don't want to rush that, I would say. But again, if you're outside, maybe try and think of a way to bring them inside.
My concern would be the spinal cord injury, of
Absolutely.
course, and I fell off a ladder years ago. And I didn't feel like I was hurt, but I was afraid that I might have had a spinal cord injury. So I stayed put
Mhm.
and made them call 911.
Yeah, and that's
I was okay, but it was like, I didn't know, so there wouldn't necessarily be pain with that kind
Absolutely.
of fall, right? So.
yeah. Typically there is, occasionally there's not, depending on what the injury is.
Yeah.
Again, if it's the person that fell is conscious, listen to them. If they don't want to get up, if they want you to call 911, call 911. Like it's not a bad thing. That's the nice thing about falls is usually the people that fall, they can talk to you, they can tell you what's wrong, and they can tell you how they want to proceed. If they just took a pretty nasty spill, they had a big trip, they didn't catch themselves well, and they want to get up right away, maybe slow them down a bit. Tell them to take a second, even if they are truly not hurt, it's not bad to just take a minute, think about your body, what's going on. Yeah.
I said broken ribs.
Yeah, exactly. If someone has a broken rib, you'll probably know. But yeah, so when in doubt, just use your best judgment. If the person is conscious and wants you to call 911, go for it. If you really think that, ooh, that leg doesn't look right, you should call 911. But typically, most trips and falls, they're not too bad, but they can be. So just proceed with caution, but it should be pretty cut and dry. Now we're going to go into some unconscious injuries. So the first step of, let's say you find someone that's unconscious, or you see someone become unconscious. There's just a few quick steps to kind of get to see what's wrong and what might be happening. So the first one is kind of extra factors, or I was told it was scene safety. You want to make sure that whatever happened to this person isn't going to happen to you. They got hit in the head by something, you want to make sure that nothing's going to hit you in the head. Because if you get hurt, you can't help them. And out here, that's pretty unlikely. But if someone slips and falls unconscious in the parking lot, you want to make sure that you're also not going to slip and fall. So that's step one of anytime someone's unconscious, make sure that you also won't become unconscious. Then you want to determine their level of consciousness or responsiveness. There's 2 levels, auditory and pain. So if you see someone unconscious, you go over, you say, hey, can you hear me? Can you hear me? Can you hear me? Sometimes they'll groan, sometimes they'll open their eyes, sometimes they'll move. It's a good sign. You want someone to be able to listen to you if they're unconscious. If there's no response to that, you want to look for a pain response. The easiest way that I was taught to do that is called a trap pinch. You guys can all feel your trapezius muscle right here. And all you gotta do is take 2-3 fingers, give it a nice hard squeeze. You can tell it's a little painful. It's not gonna cause any damage, but it hurts. And so if someone's not responding to your voice, you can just give them a quick pinch. They might groan, they might shift, they might actually wake up. And that's, again, a good sign if they're at least a little responsive. If they don't respond to that, that's a start a 911 call. Anytime someone's unresponsive, even if it's for 30 seconds, if they didn't respond to pain for those 30 seconds, that's some pretty serious stuff happening. And yeah, we'll get more into a little bit more of the details of it in a bit, but let's say they are responsive to your voice or they are responsive to pain. You want to make sure that their ABCs are intact. I'm sure you guys have all heard ABCs, airway, breathing, circulation. For airway, all you got to do is just look in their mouth. You can pull their jaw down, you can tilt their head back, just find a way to look in their mouth. If you don't see anything, that's great. Typically, if you do see like a piece of gum or, you know, maybe they were eating a bit of cookie, pull that guy out. Because if they are unresponsive, you don't want that to go further down and block their airway. If you think there is something blocking their airway, but you can't see it, you don't do it. Even I was told you don't ever reach down a person's mouth to grab something you think might be there, just on the case that you might actually push it further in, make it harder to get out later. So that's the first thing. You want to make sure that their mouth is clear. Next is breathing. You just want to see if they're breathing. It's pretty easy. You can put your face next to theirs. You can listen for their breath. You can feel it on your skin. You can look at their chest to see if it's rising and falling. If they're breathing, great. If not, you've already called 911. And then lastly, circulation. Easiest way to check a pulse on someone that's on the ground. Typically they're on the ground if they're unconscious or if they're seated, is the carotid pulse right here. Just 2 fingers right to the side of the neck. You can all feel it on yourself. It's pretty easy to find. You don't want to push too hard that you're actually obstructing their airway, but that's pretty tough to do, especially if you're kind of off to the side. And that's kind of, do they have a pulse? If they don't, you're starting CPR. We'll get to that in a minute, but hopefully everybody has a pulse. Yeah, and then when you're looking for apparent injury, you're also looking for any bleeding. You know, if they did fall and they broke their leg and there's, you know, a snapped artery or snapped vein in there that is bleeding a lot, you're going to want to try and stop that just because a person can die from blood loss a lot quicker than most things. If they're not breathing, they're going to die the quickest. If their blood's not pumping, they're going to die the second quickest. And if they're losing blood, they're going to die the third quickest. So you want to just take a quick look at them, just make sure that there's nothing super immediately wrong. You know, they're not losing blood. Don't have a cracked skull, nothing like that. It sounds super intense. You're very unlikely to encounter stuff like that. But just in case, you know, and when you're calling 911, these are the kind of things that you want to tell them. They might ask you this. In fact, they probably will prompt you, say, are they breathing? Do they have a pulse? Are they bleeding? That kind of stuff. But it's good to just look for it on yourself. So, some unconscious injuries. First and most common, probably fainting. We've all fainted before, you know, you stand up too fast, you fall right back down. You get a little low blood sugar, you're a little dehydrated. Typically not a big deal. Someone that faints will usually respond to your voice or pain within 30 to 45 seconds of passing out. This one, it's not too bad. If they don't come back within a minute, that's a call to 911. Not necessarily because they won't regain consciousness, but just because that time spent unconscious, there's a lot of unknowns that happen there. And that's a thing that you want to get checked out. And if once a person regains consciousness, don't get them up too quickly. Let them take their time. You can kind of put their feet up, make sure there's a little extra blood to their head, and then eventually move to sitting on the ground, and then sitting in a chair, and then standing up. You just want to take your time. You know, I'm sure we've all fainted, and you're a little groggy afterwards, and you don't want to move too quickly. Get them some water, maybe get them a little snack. Again, pretty common, usually not that serious. Someone that faints will come back in 30 to 45 seconds usually. Nothing too crazy. Seizures. Yeah, electrical mishaps in the brain. This one, people will likely find their way to the ground. you notice someone fall unconscious in their chair and they start kind of jerking, maybe help them to the ground. That's gonna be the safest spot for a seizure to occur. And you kind of just have to let it happen. There's nothing that you can do to stop a seizure. There's nothing that a medical professional can do to stop a seizure, even in a hospital setting. Yes, they can give you certain drugs to make it easier and make it less violent, but seizures are gonna happen. So you don't want to restrain the person in any way. You just want to make sure that their head is protected. I've seen videos of seizures where people are spasming so much they're hitting their head into an object nearby. So you just place a hand on either side just to make sure it's not going to go anywhere. And give it some space so it can still move freely, but you don't want it to hit anything that might cause further harm. And then the time for seizures is 5 minutes. Anything under 5 minutes is usually pretty okay. That's not necessarily a call to 911. That's a, hey, I've never had a seizure before. I should probably go to the emergency room myself. Again, if you have another one on the way there, have someone drive you. But if you have another one on the way there, that's it. Call over, call 911. I just had 2 seizures in a day. I've never had them before. They'll help you out. But typically not too bad. I know people that have seizures, they have a seizure disorder, they take medication, they still get seizures from time to time. They're not too bad. They usually last less than a minute. Some can last 3 or 4, but as long as it's kind of under that 5-minute range, that's just fine. And again, with this, someone has a seizure and you're not quite sure if they're okay, call 911. They'll come check them out. They'll determine if they're okay. That's a great resource. Like you don't have to be the one to make that call. If you're worried, if they're worried, that's a good thing to have checked out, especially if it's never happened before. That can be really scary. I remember I was in my 5th grade class and a girl in my class had a seizure and none of us knew what was going on, but she fell out of her chair. I saw her leg kind of twitching on the ground. And my teacher responded great. She said, somebody go get the nurse. The person closest to the door ran and got the nurse. She went over and just kind of made sure she was okay. She was able to get up, walk down to the nurse's office. Paramedics came, checked her out. She was just fine. Learned later that she was diagnosed with a seizure disorder. And so she started medication. And not to my knowledge, it didn't happen again, at least while we're in school, but it's a pretty common thing and usually not too bad, especially if you can deal with them quickly.
I was with my mother when she had her first grand mal seizure. She had more than one. And I was so grateful because I wasn't supposed to be there, but I was.
Yeah.
And she was seated in a chair. She stood up. She made this guttural sound and she crashed to the floor. Now, in the process, I've heard it said that with grand mals, you can actually, the bones can break just from the muscle action, but she cracked her shoulder. And so, and it got worse because we didn't know that, and the EMTs actually grabbed her shoulder to turn her over. She was a very big woman. And it was fascinating to realize you're completely helpless when someone has a grand mal. And then afterwards, unlike the story you had told about your classmate, she was just groaning and moaning and there was no communication capacity at all. So it's a very scary thing to be in the process with someone, but I have to admit now that I've been through the process, everything you say, you can't do a thing except make sure that she's safe.
Yeah, if someone is experiencing specifically grand mals, you can make sure they're not going to choke on their own spit. They don't have anything in their mouth. You can make sure they're still breathing. You can make sure their heart is still pumping. Obviously, if they're spazzing, their heart's still pumping.
Exactly.
And that's all you can do is you can call 911 and you can make sure they're still breathing. And as long as you're doing that, that is something effective that you can do just to make sure that they will turn out better.
They used to tell us to put something in their mouth so they don't swallow their tongue or bite their tongue.
Don't do that. Yeah, anytime someone's unconscious, there are things that are called tongue blades that paramedics use occasionally. Even I was instructed not to use that in my EMT course, just because there's specific techniques and specific ways to make sure the tongue is secured that are way too complicated and can be messed up really easily and cause a lot more harm if you do mess it up. So you don't want to put anything in their mouth, make sure their mouth is clear of anything, including specifically gum. That's the biggest one that people are likely to have in their mouth that can get lodged, yeah.
I have a grandchild with epilepsy. And those grand mal seizures come with an awful lot of side effects.
Mhm.
Now, we've been told no more than 3 minutes,
Mm.
and then she has drops that you put in the corner of her mouth, just drip it in to help bring it to a close.
Mhm.
But afterwards, they're not okay.
Yeah.
She's very wiped out, disoriented. Her speech is garbled. And one of the problems can be their bladder, they lose control.
Absolutely.
Everything comes to a halt,
Yeah.
and it's awful.
Yeah.
It's just awful.
Yeah, and it's a brutal thing to witness. It's really scary. And I remember when I was working at Christicon, we do a camp for adults with developmental disabilities. We had some campers that had seizure disorders, and I saw a guy that was about twice the size of me fall down and have a seizure, and it was terrifying, because it's violent. But you can't do it. You just gotta make sure they're okay afterwards.
One thing that's important though is not to show them how horrified you are, because they're coming to
Absolutely, yeah.
not even realizing necessarily what happened.
Yeah.
And if you're acting like something is awful,
Yeah.
it's scary.
You wanna try and keep a straight face. Again, don't neglect your own
No,
emotions.
you can't keep
Yeah.
it straight.
I know that I'm a person that can kind of keep a calm demeanor in those situations. That's why I chose to become an EMT. If you're not, that's okay. It's better that someone's there to help them, even if you're scared. But if you think, oh, there's 10 people here, I can take a step back because I'm really freaked out and it looks like more people are other people are also calm. Let them take the lead.
Just be reassuring and tell them they're okay.
Absolutely, yeah. Or that they're going to be okay, yeah. Because things might not be okay, and that's okay. Yeah.
I think that's really important to orient them to where they are. And maybe this is common sense, and maybe people would do this anyway, but if there's people in the room to get them out. So that when they awaken, if they soiled themselves or whatever, they don't have a lot of people watching and they're embarrassed and all that. when they-
Yeah, and this is a great time to mention it. If you have an emergency in the middle of service, you don't necessarily have to clear everybody out of the room. You just want to give the person that's experiencing the emergency enough space to kind of feel that they're not all eyes are on them, And a great thing to do is, especially if you have 911 coming, just make sure that they have enough room to get into where you are, if the emergency happens with you, the people in the surrounding rows might want to vacate, maybe even move some chairs just so that they can get in and be helpful. I think one of the hardest things to do is witness an emergency and not be able to do anything. I've seen some stuff, and when I'm a bystander, I am emotionally much more wrecked than if I'm able to help. And so I think a great thing that we can do is say something happens in the middle of service. You give people space, paramedics are coming, you have someone go out to the door. You have someone wave them down and say, hey, they're in here when they get here. The rest of you can kind of give them space. If you want, you can leave the room, you can come to the gym, you can go back to the choir room, you can do what you want, and just pray. I think that's a really effective thing to do. Whether or not you believe that it's gonna have significant outcome right there, it's something to take your mind off. And a prayer for them is a prayer for you, it's a self-soothing thing as much as it is for the person experiencing that emergency. Yeah.
I had something happen to me in church in the middle of service, and the gentleman next to me, I became aware that he seemed unconscious. I was totally unaware of anything. I just kind of put my arm around him, and we were standing at the time, and he stood. I don't even remember what happened. I don't know if he came to. Did he faint? Probably. Or?
Most likely, yeah. Most likely just kind of called a syncopal episode where your brain just doesn't get quite enough blood, and so it shuts down some of the stuff that it doesn't need to have running all the time. And so you just kind of, you might notice the head droop. Sometimes people are able to stay standing. But yeah, just giving them support. That's about all you can do. And you did a great job, yeah. Of course, falling unconscious is one of those tough things because the person can't tell you what's going on. And even in my training, they're like, sometimes you just won't know. You can go through a bunch of steps to make educated guesses, but at the end of the day, that's all they are, is their guesses. So you just do the best with what you know, and your best is good enough. I'm gonna keep going quick because I got some more stuff to get through, but I'll have some more time for questions at the end. Heart attack, it's the big one. I'm sure you've all heard various informations about heart attacks. They're easier to identify, but at the end, there's no set line of symptoms that someone having a heart attack will experience. Everyone experiences them differently. Again, most of the information that's put out about heart attacks is actually only studied on men. Women experience heart attacks in a much different way. So at least for both genders, for the most part, chest pain is the one that's most frequent. In men, it'll be a little more present. For women, it's usually just a little bit uncomfortable. For men, it's pretty darn uncomfortable. It's gonna feel like real tightness in your chest, like you can't get a good deep breath. And that pain will often, at least in men, radiate to the left arm and the jaw. For women, it's more towards the back. And then for women, they will also experience more shortness of breath. Men will experience a little shortness of breath. Anytime you have chest pain that is unexpected, that lasts longer than you want it to, it's okay to call 911. Because a heart attack is one of those things where you do not want to chance it. Even if you having some bad indigestion that you're just not familiar with, better to call 911 and not be having a heart attack than be having a heart attack and not call 911. Other sometimes symptoms is nausea, vomiting, dizziness, sweating. A lot of people that are having heart attacks start to sweat because their body just kind of goes into overdrive. And then just kind of tiredness, fatigue. In my EMT course, we read a story of someone that she was a nurse practitioner that had a heart attack at home. The first thing she noticed was fatigue. She was like, and it was her off day too. So she hadn't been working all day, but it was the evening and she was just like really tired. And then she stood up to, start making her way to bed and she was just a little short of breath. And then she felt a little bit of back pain coming on and she said, oh, I think I'm having a heart attack. And within 2 minutes of her having that thought, she was on the ground unconscious. But she had called 911, she had unlocked her front door, paramedics were able to come and restart her heart. And that's why we had that story. So it can come on quick. From 2 minutes of feeling tired to her heart stopped. And so it's one of those things, if you start to have chest pain, if you start to have shortness of breath, it doesn't matter if you're in the middle of the service, you lean over to the person next, you say, I'm having chest pain, call 911. That is the first thing you do. So someone does have a heart attack and they do fall unconscious. They're unconscious, they're on the ground, they're not responsive to sound, they're not responsive to pain. They're breathing, their airway's fine, but you don't feel a pulse. That's okay. If you don't feel a pulse, you've called 911 because they're not responsive to pain. You call 911 and you say, I think someone's having a heart attack. We don't feel a pulse. The best thing to do is to, if you're the person on the ground with the person and you don't feel a pulse, you point to someone, you say, you call 911, say, you grab the AED. Because if you just say it out into the world, either a bunch of people are all going to do the same thing, and that's a lot of misinformation specifically for calling 911, or a bunch of people are going to run and not be able to get to the AED, or the opposite, no one does it because they assume someone else is going to do it. So it's great to point and get yes. If you get pointed at and say, you call 911, I say, yes, I'll call 911. You get pointed at, so I'll go get the AED, say, yes, I'm going to get the AED. That verbal confirmation is really important. One of those things that you might forget, it's not the end of the world, but it's really helpful just to make sure that everybody's on the same page, you're moving with efficiency. So the AED lives just through those doors, right on the other side of the kitchen, kind of by that little trash nook. There's a white box on the wall, it says AED. All the stuff that's in there is all of this, these 3 black cases, and then there's a couple extra CPR face shields in there. Nothing too crazy. I'll go over it here in just a second. When you're doing CPR, what you're striving for is 100 compressions a minute. Compressions are pretty easy. I'm sure you've been all somewhat know how to do them. You grab your hands like this, you're pushing right in the middle of the chest, going about 2 inches in. Saying staying alive, you're going for something like that. Rescue breaths are kind of the one thing that has changed over the years. Now it's not necessarily super important to give rescue breaths. Unless they're experiencing some sort of respiratory related heart stoppage, drowning, opioid overdose, things that kind of compromise your breathing. So if someone has a heart attack, they're probably not going to need rescue breaths. It's one of those things where if you give them, it's not going to hurt, but it's also not going to be the most helpful. And so, if someone, you see them just fall over, they were fine a minute ago, and they don't have a pulse, that's a sign that you don't need to use rescue breaths. So while someone's going to get the AED, someone is starting CPR. You're going for about 30 compressions at a time, and that's when you would either give rescue breaths or just check again to see if you feel a pulse. You don't want someone to check while you're doing compressions because the compression is actually circulating the remaining blood throughout the system. You're beating their heart for them. And even just in my brief refresher to make this presentation, I remembered that CPR is not a life-saving measure. It's a life-sustaining measure. You're not going to get someone back by just doing CPR. You're not going to restart their heart by just doing CPR. That's just to make sure there's whatever oxygen is in their blood is continuing to cycle throughout their system. And so it's a long and sometimes very exhausting process. So if you're in a room of people, you get a team lined up. You just stand behind the person doing compressions and you say switch. And it's helpful to switch every 2 rounds. So you go for 30, check, go for 30, check, switch. Again, not super likely that it'll last a long time. We're pretty close to the Roseville Fire Station. I think they have an ambulance crew. And so they can come and check it out pretty quickly. And so now we're going to go into what the AED actually looks like. So the AED itself is this big yellow and black box. It is probably one of the easiest pieces of medical equipment to use. You open it up, first thing you see down here is a big power button. That's the first thing you do. You just press the big power button and it'll tell you what to do. There's speakers inside here that say, do this, do that. They say, attach the pads, don't touch the patient, start CPR. They tell you exactly what to do. So you press the power button, that's the first thing. That gets it on, gets it charging so it can deliver a shock. Then it'll pop open. It's got this white packet here. These have the pads that you attach to a person's chest. You want to put this on skin. It doesn't go over clothes. And so if they're wearing a shirt with buttons, you unbutton it, you get it off. The knot, you just lift it up and you go. There is no modesty if you're dead, right? You want to make sure this person stays alive. So these pads, you just open them up. There's pictures on the packet and on each of the pads that tell you where to place them. Super easy. You go one over the heart, one kind of on the right side here. It'll tell you where to place it. They're already plugged in, so you don't even have to do that. It'll tell you to stop touching the patient. It'll analyze their rhythm. If there is a shockable rhythm, it'll say shock advised. There's a little shock button here. Okay. Yeah. You press that, you get shots. It's one of those things, hopefully you never have to use it. Most likely you won't. But this is one of the few things that can restart a person's heart. Yes.
There's a DVD in the office, and talk to Kristen if you want to take it home and look at it. It's really a good DVD and gives you a lot of information on how to run it.
Absolutely, yeah. And I really encourage you guys to just take a CPR course. Even if you don't become certified, having that information delivered by someone that's trained to give that information is really valuable just in your everyday life, because worst comes to worst, you know how to do it and someone else doesn't. It's one of those skills that won't ever fail you.
Maybe you said this, but how do you know when just to do compressions and when to use the shock?
When you don't feel a pulse.
Okay,
So if you don't feel a pulse, you're starting compressions right away while someone else grabs this.
okay.
That's an always, you just applying this to them is not gonna hurt. A shock will hurt, but it's only gonna shock you if it's necessary. These things have become enough advanced that they're not gonna deliver a shock, or they're not gonna tell you to deliver a shock if a shock isn't helpful. So if they have no heartbeat, that's a non-shockable rhythm. It's not gonna tell you to shock. just keep going.
So compressions, you said won't bring them back
Correct.
with this.
Yes,
Okay.
yeah,
I'm wondering, we got the AED in memory of my daughter who died in 2005. Now Jim Erickson was able to buy this AED. Because you worked at, where did you work? Where? Medtronic, yeah. And my question is, and I don't know, I think I talked to Jim about it, I'm not sure we have an answer. He's replaced it once and upgraded. But it's old. I wonder if there's any problem with it getting old, or will it always be
no,
up to date?
I think the only kind of advantage of replacing it is you get something that's a little clearer to use, but even this model right here, in my days in the boy choir, we had a kid that had a heart condition, we traveled with this exact one, never had to use it, he still has it to this day, he still brings it on some of his trips. You know, it's, an old AED is better than no AED, and a new one is just gonna be a little more expensive, maybe a little nicer, maybe a little easier to use, but
Because this was purchased in about 2005,
it's still
so
good,
it's old.
yeah.
It does have a self-checker, and as long as it says okay,
Yep.
it's ready to go. It
Okay.
constantly
Yeah.
monitors all this stuff.
It's got a little screen up here.
And when the trickle battery goes bad, then the pads have normally gone to their expiration date. We just buy the whole thing and we just put it all back in there, and yeah, it checks itself all the time.
Okay, that's good.
That's the nice thing about it. So, and then also attached just briefly is a little CPR face mask for giving rescue breaths. It's nice to use one of these, that just ensures that your air is getting into the person that needs it. Again, probably a little unlikely that you would need to use it, but it's there if you need it. And then this little one is different pads for infants and children. They're a little bit smaller pads, they give a little less powerful of a shock, just because a full adult shock can cause a little bit of harm. But let's say you didn't have this, an adult pad is better than no pad on a child. The saying that I was taught is an AED is better than good CPR. Good CPR is better than bad CPR. Bad CPR is better than no CPR. You know, it doesn't hurt to try. If someone's super confident, they say, I took a CPR course, I'm good to go. Maybe let them go in front of you if you're a little less confident, but again, be willing to help if you need to. That's
Bjorn?
that's that,
Another
yes.
thing that occurred to me is, I know how strenuous it is to do CPR compressions for an extended period of time, you've got people lined up. I would also encourage that someone else be the one to check for pulse. So that the person is not doing double duty, just focusing on one thing at a time.
That's a great way to do it, yeah. The way I was taught to do it is you work in a team. You got one person going, they count to 30 out loud with their compressions. Once they get to 30, take their hands off. Person checks, they say, keep going, or back at it, or more compressions, or some affirmative statement to say, keep going. Yeah, I'm gonna go on to the next slide real quick and then we'll come back if we have any questions, just because this is the last thing I have for you. Narcan. This is a little box. This lives here in the church. It's right next to the AED. There's a little red box that says opioid overdose kit. Comes in a box just like this. I won't open it up because it looks just like that little thing. There are 2 doses in here. Narcan is one of the easiest things to use. You put it up their nose, you spray. Kind of the qualifying signs for an opioid overdose is someone that's unresponsive, maybe only responsive to pain, they're not hearing you. Typically, they will have, or it won't necessarily benefit them unless they have kind of decreased respirations, if it looks like they're breathing slow or shallow. And then the real telltale sign is their pinpoint pupils. Even if they're outside in bright sunlight and kind of cover their eyes with a little bit of shade, it'll still be super tiny pupils. That's a sign of an opioid overdose. That's when you want to give them Narcan and call 911. And Narcan is one of those things, if you're not having an opioid overdose, it's not going to hurt you in any way. So if you are at all suspecting that that's what someone's having, go ahead, give it to them. You know, it's one of those things where it's not going to hurt anybody. this is one of the things we're probably really unlikely to see here. This is something more common, just kind of out in the wild, out on the street. You know, this is something that most likely won't happen here, but a good thing to be aware of and say, we do have it over there, we need it. And again, use it if you think you need it, if you don't, that's just fine. That's kind of all I have for collective information. I'm happy to answer your questions. I'm sure some of them will be very specific. I will try to give great answers, but in kind of general, use your best judgment. If you think you need to call 911, call 911. Send someone out to go look for them, give them space to work, and just kind of proceed. Michael?
Regarding chest compression.
Yes.
I understand that it's possible to do some structural damage if you do it the way it should be done.
Yeah, it
So
should.
don't be afraid to do it too hard, even if it looks like you might be breaking something.
Yeah, it's actually very easy to break ribs when you're doing CPR if you're doing it correctly. You want to go for 2 inches of compression. 2 inches is a lot, especially on a person's chest. Like the sternal bone there is really firm. You can crack it if you're doing it well. And so yeah, don't be afraid to really put your weight into it. Even on those practice dummies that are old and worn out, I push all the way through to the floor, just because going too deep is better than not going deep enough for those compression. And you know, you really want to put your full weight into it.
You wanna be on the floor, not in a bed.
Yes, yeah, ideally, you want to be on the ground, but you know, hopefully we don't have any beds here that people. You never know, but
Well, it happened with my mother.
yeah.
And my dad was trying to give her
Oh, yeah.
compression on the bed.
Yeah.
And my brother said he should put it on.
Yeah.
He was fine.
So you say call 911. The phones have kind of changed over the years here. Where are the phones?
Usually they're in your
I know that usually they're in your pocket, but I know there's one behind the desk, just right as you're coming into the sanctuary. There's one in the office, and there's one in the kitchen. Those are probably the closest and easiest to get to if you don't have one in your pocket. Chances are, if you tell someone to call 911, pull that phone out of their pocket, but kind of call 911. Again, if you're calling 911, it's great to say, I'm gonna call 911 nice and loud so that the dispatcher isn't sorting through multiple calls. Yeah.
Could you describe use of the CPR mask? That's new to me.
Yeah, CPR mask, it's pretty easy. It's just kind of a sheet of, looks like plastic almost. This one's a little bit more in depth, so it just looks like this, super easy. There's a side with a little bit of a tube, that's the side that your mouth goes on, and then the side without the tube, you just put over their face. Ideally, you want to go for a full seal around their nose and mouth. There's a little bit of air, it's not going to be the end of the world, but yeah. Plop it over their face, breathe into it. And it's one of those things that it's easy to mess up, but trying is better than not doing it at all.
Thank you.
I think that calls it. Thank you guys.
Okay.